You're a surgeon in London in the 1840s. You've studied anatomy for years. You've read every surgical text available. You are, by any reasonable measure, one of the best in the city. And none of that changes what the next 20 minutes are going to look like. The theater fills up before you arrive. It always does. Medical students, visiting physicians, the occasional curious gentleman who paid for a seat in the gallery. They're holding pocket watches. Someone in the back is already taking notes. This is not unusual. Surgery before anesthesia is, among other things, a spectator sport. Your assistants are already positioned around the table when you walk in. Their job today is not surgical. Their job is to hold him down. The patient is a man in his 40s. He's been given some wine, maybe a small amount of opium, which will take the edge off in the same way that a single candle takes the edge off a very dark room. He's conscious. He is aware of everything happening around him. When he sees the instruments laid out on the tray beside him, his breathing changes. You've seen this before. You've seen it hundreds of times. You don't make eye contact. Not because there's nothing useful in that exchange right now. You check the instruments. You check the position of your assistants. You nod to the student with their stopwatches. Time me, gentlemen. Time me. You have to be fast because speed is an asset. The faster you are, the less pain you inflict. The moment you begin, he starts. And I want you to understand, this isn't crying. This isn't just the sound of someone in discomfort. It's much more than that, because pain at this level doesn't produce ordinary screaming. Your assistants press down harder. The man is strong, even now, even like this, and it takes everything they have to keep him still enough for you to work. You don't stop. Stopping is not an option. Every second you hesitate is more blood loss, deeper shock, higher chance he doesn't make it off this table. So you move. You move as fast as your hands will carry you, which is faster than almost anyone in this city, and you do not look at his face. The leg comes off. You suture. You dress the wound. The whole thing has taken under 2 minutes. He's still alive. For now, that's the best possible outcome. The students in the gallery are writing down the time. A few of them look slightly pale. You've stopped noticing that. Now, here's what nobody outside this profession fully understands. You chose this. Every morning, you walk back into that theater knowing exactly what's waiting, knowing the sounds, knowing what it takes out of you, and you walk in anyway. Because the alternative is these people die from whatever brought you to them in the first place. A slow death from a gangrenous limb measured in weeks of deterioration versus 20 minutes of the worst pain imaginable, and then a chance at survival. You are the chance at survival. That's the deal you made when you took this on. But there are days when the deal feels heavier than others. There was a case not long ago that you still think about. A young woman, a mastectomy. 7 surgeons in the room because the procedure required that many hands. She refused to be held down, said she'd stay still on her own. A handkerchief was placed over her face. When the blade went in, she began screaming, and she did not stop for the entire duration of the operation, completely uninterrupted, start to finish. Afterwards, she wrote about it in a letter to her sister. Took her 9 months to find the words. She said she almost marveled that the sound still didn't ring in her ears. This actually happened, by the way. It happened to Frances Burney in 1111, and this was how she described the experience. I began a scream that lasted unintermittently during the whole time of the incision, and I almost marvel that it still does not ring in my ears. You were not in that room, but you've been in rooms exactly like it. You do the work, you do it fast, because fast is mercy. Most of your colleagues are the same. You don't talk about it. There is no language for it, really. No framework in this era for what repeated exposure to this kind of thing costs a person. You just keep going, because the patients keep coming, and someone has to be in that room, and you are better at this than almost anyone. So tomorrow morning, you'll wake up again. You'll walk into the theater. The students will take out their stopwatches, the assistants will take their positions, and the patient on the table, whoever they are, whatever brought them there, will look at you the way they always look at you, and you'll do what you always do. Would you go for a surgery if you were born in those times, or is death a better option?